Welcome to the Remarkable Dentist Podcast with me, Fred Joyle, where I interview amazing dental practice owners digging into their successes and failures, their insights and hindsights, getting their views on where dentistry is going, and discovering what it took for them to become remarkable. Welcome to the Remarkable Dentist Podcast. My special guest today is Dr. Rick Myron. He is perhaps going to be the most educated dentist that we will ever have on this podcast. He is currently a postdoctoral researcher in the Department of Periodontology at Nova Southeastern University down in Fort Lauderdale. But he has a master's degree in medical science and cell biology from in Ontario. You picked that up, but then you went and got a PhD in molecular and cell biology in Bern, Switzerland, and then finally got your dental degree back in Canada. And now you're doing heavy research. We're going to talk a lot about plasma-rich fibrin and its applications in dentistry and facial aesthetics, and how that can affect your production and open up new opportunities in your practice. And you're going to hear a bunch of great clinical stuff. A lot of it I'm not going to understand, but that doesn't matter because I think you're going to be amazed at it. I've heard a lot of it and it just blew my mind, and I just had to get Rick on the show immediately. So Rick, welcome to the Remarkable Dentist Podcast.
Thank you. Thank you for having me.
So let's start right at the top and explain what plasma-rich fibrin is.
Yep. So the real scientific term began when it was PRP before it was PRF. So it was platelet-rich plasma, and then it's platelet-rich fibrin. And the difference between the two are very simply, it's just related to whether or not it's got anticoagulants or not. Okay. So very simply, researchers figured out what all these different cells do in the body. So for example, we know white blood cells fight infection. We know red blood cells carry oxygen, and we know platelets help with regeneration. Okay. So very simply, you can concentrate each one of these cells with a centrifuge. So it's a device that's spinning very quickly and it's separating all these cells based on their density. Heavy cells go down to the bottom, light cells come up to the top. Okay. And so after you spin, you could take, for example, whole blood. And if you have X amount of platelets or stem cells or whatever it may be in this concentration of blood, you spin, and then you can specifically go and say, here's my white blood cells, pull them out. Here's my red blood cells, pull them out. Here's my platelets, pull them out. Okay. So the best example that I can give people just to understand how the technology works is, for example, like a Lance Armstrong, so these turbo athletes, when they're doping and they're doing illegal things, what he was doing, which is smart and every athlete will do, they go train in high altitudes. Why do they do that? Well, the more red blood cells you have, and those cells carry oxygen, the more of those cells you have, the faster you're going to ride your bike. So an Olympic athlete is going to go as high as he can, and he's going to do as much of his training at high altitude, get more red blood cells. When you go back to sea level and you're racing the Olympics or these races, et cetera, you're going to be more performance enhancing, quote unquote. That's a legal way to do it, right? If you want to cheat the system and do it illegally, you grab blood. Okay. So Lance and what these athletes do is they donate a little bit of their blood. And when you ever watch the TV shows that talk about the documentaries, you see all of them with their little blood bags that are in these little cars and other things. And what they were doing is donating blood before these races. Okay. Spinning them, concentrating the red blood cells before the races. They take the red blood cells because they know they carry oxygen, pump them back into the system. Now, all of a sudden you got 20, 30% more red blood cells and you're riding your bike faster. Okay. That's completely illegal, right? In sports, It's performance enhancing. It's completely illegal. In medicine, if we know, for instance, that white blood cells fight infection, right? Well, if you have a very serious infection, I can do the same process. And, a lot of things, the amazing thing about a lot of these sports, et cetera, is they develop a lot of technologies that can then be used in medicine. And so you can use the same technology and where the cells are going to now separate, go in and grab the white blood cells And now I got 10 times more the concentration of white blood cells. Well, these cells fight infection. I then take it to your defect and I say, here you go. This will give you a better chance to fight that infection. And that's what we do. And amazing, in science, we use the same technology, and you're considered now a great doctor by using the exact same technology that's completely illegal in sports. So what we've learned over the years is, of course, platelets are the cells that are responsible for regeneration. They are the cells that carry a lot more of the growth factors that help with healing. And so we concentrate these cells and we use them for regeneration. And it's utilized in practically all fields of medicine. So it can be for diabetic ulcers. It's utilized a lot in sports for knee injections. So it's completely illegal for you to performance enhance. Okay. So if you want to, like the Lance Armstrong, Kate, that's completely illegal. But if you're the same athlete and you have a knee issue, so when you see these Rafael Nadals and Kobe Bryant's and different athletes, when they have knee issues, what do? Typically, many years ago, they'd fly to Europe and they would get their PRP injections. And that's your platelet-rich plasma or platelet-rich fibrin injections, where they'd concentrate those platelets and then use it. And that's considered legal. So if this is where you should be, and all of a sudden your knee's been degenerated and you're down here, it's legal for you to bring it back. But it's not legal, in sports to go.
To enhance, yeah. So, and that's the one I'm most familiar with. You can tell my ignorance because I'm calling it plasma-rich fibrin, but it's platelet-rich fibrin. I was more familiar with platelet-rich plasma for exactly those injury treatments, which is very effective. And it's your own blood. There's no rejection issues, right? It's your own body that is getting a concentrated dose of what it needs in the area.
Yep. So precisely exactly that. And like I said, where it's been shown to be most effective is areas of low blood flow. Okay. So for instance, the number one place that I see it utilized, where I think is just the results are amazing, is diabetic ulcers. So for instance, when you look at somebody with diabetes, okay, if it gets really, really bad, what happens? They get an amputation. Where are their amputations most commonly? The feet, right. Limbs,
extremities.
Right?
Yeah. So.
And it's the furthest place away from your heart.
Yeah.
It's got the lowest blood flow. So if you have a technology that can concentrate blood flow, basically all the proteins and regenerative factors, they can use it and bring the blood flow and the growth factors for the blood flow down to the areas where they're very deficient. Okay. So in dentistry, amazingly, it's a great technology and highly utilized in the field of dentistry because, number one, where do we have a lot of infections in the body? And the answer is your mouth. And the reason why, of course, and the reason periodontal disease, for instance, is the most common disease known to man, right? It affects 30-40% of the population. Why? Well, there's lots of bacteria living in the oral cavity. So if we have a technology that can concentrate these white blood cells and then use them during the procedures, where when we do the work that we do in dentistry in the oral cavity, you can lower chance of infection. And that's been shown in a lot of randomized studies. And of course, that's always better for your clinicians because now your grafting cases and whatever treatments you're doing, the chance that you have complication goes down, right? And of course, it's, you have a lot happier patients, healing occurs faster, et cetera. So that's the basis of the technology. When you look at blood flow, the sad reality is that as you age, the blood flow in your body gets lower and lower, right? You're not increasing vascularization as you age. Everything's going downwards. The amount of stem cells in your body is going down. The regenerative potential in your body is going down. Everything starts to sag a little bit as you get older, right? Because the blood flow is not supporting these tissues anymore. And you can speed that up if you wanted to. If you all of a sudden you start smoking, you got lower blood flow. If you become diabetic, it's lower blood flow as well. And so this technology, when we have patients that come in and they say, I'm a diabetic, and on top of that, I'm a smoker, maybe obese, all these different things, then you say, okay, this person, when I look at him, I say, your regenerative potential is going to be lower than the average person that I treat. And as a result, I would love to use this technology to try and, help you out, basically.
So the last degree you got actually was the dental degree. Was your interest always to go in dentistry, or did that suddenly become the best application of all of this education?
Yeah, actually, my last degree is not my dental degree. I did a dual degree with dentistry and PhD at the same time. So I did
Oh,
a
okay.
combo degree, and I had known that I wanted to go in that field. And then after that, I went to Switzerland, and then I did what's called a Doctor Med Dent degree, and that's more related to medical applications, and got me a license in that area. And then I did 2 postdocs. So I did training at the University of Michigan, which is a very good dental school. I did an ITI fellowship there, which stands for International Team for Implantology. I did live in other areas too, and worked in different places. So I've spent my whole life in university. Basically, I've got 17 years under my belt of hardcore studies, so and 7 degrees. So.
Well, yeah, but you express this stuff very clearly. We were recently in a room together, and you had 40 doctors in the room, and they were rapt for 2 days straight. I watched their faces, and their minds were opening up to just the new biomedical opportunities for dentistry. I mean, I think they were excited, but I think they also saw how this is going to imply in a very practical way in new treatments to their patients. And I really want to get into a bunch of those things, but also a wider range of treatments. PRF has a whole bunch of applications, obviously, in terms of facial aesthetics and things like that, right? So,
yeah, the technology itself is able to be utilized in practically every regenerative procedure that we do in dentistry. And so it just helps with healing. And of course, one of the benefits to doctors is that it's a autogenous technology, which means it's coming from your own body. So there's no chance of having a foreign body reaction. And more importantly too, it's very cheap. What does it cost you to go get 4, 5, 6 vials of blood from your patient? And the answer is literally only a few dollars. Yeah. Right. So this is a great technology that can be utilized for, in practically all cases, less than $10 for these surgical procedures. So even the slightest little improvement, it's definitely worth it, because when you're doing these $1,000 procedures and these complex regenerative things, imagine. And you can bill for it too, right? So it's not just that, but a lot of insurances will cover the technology because they know, number one, the chance of complications is going to be lower, and 2, people are going to heal faster. Okay, so the real benefit is now I have a technology that I can charge X amounts of dollars for, and it's not costing me very much, and it's improving outcomes, and. So that's the reason why, like I said, our courses typically will have 30, 40 doctors in them, and they're sold out for, months in advance, because the technology is just booming, and just feedback from other colleagues. I've been doing it now for about 5 years in the United States. In the very beginning, there's only 8 people in the courses, and, they're learning the new technology, and those 8 people tell other people, and they've been using it for 2 years. They're telling all their friends, look at these great results we're getting and improved healing. And today, like I said, I can't keep up with the growth of it, because I'm doing 40, 50 courses per year. It's pretty much every weekend that we're out in the field and helping other doctors out. So.
Yeah, and I know that our room could have had a lot more people in it if it weren't for COVID spacing, pandemic distancing, because there were more people that would have wanted, and we could have fit more people technically into the room. And then you did a full hands-on day as well with people. So give me an example, a restorative or a regenerative example that a dentist could apply this in immediately, that in his normal practice, not even adding a different set of procedures or something.
Oh, sure. So PRF is more for soft tissue healing. Okay. So it's very good for soft tissue healing. So, probably the number one example that people use them in dentistry is anytime you're using implant dentistry, for instance. Okay. When you remove teeth from patients and you restore them with implants, people always forget that the periodontal ligament, so the ligament that's actually around this tooth structure, is the main source of blood supply in alveolar bone. Okay. And it contains 60 to 70% of the blood supply. So when I pull that tooth out, unfortunately, there goes the periodontal ligament that supports that. And unfortunately, there goes 60 to 70% of your blood flow. So now you got a big issue where, hey, my bone, which is being fed, nourished by the blood flow from that PDL, is now gone. And when you place these implants, they're very much prone to dimensional changes post-extraction, which can, be improved by the addition of platelet-rich fibrin. So we use them for a lot of those cases there around these implants, and specifically around the upper portion of the implant. So imagine, this is my bone, my implant is going into the bone, okay? Up here at the soft tissue component in the mouth, there's all these bacteria everywhere, right? And these bacteria love to just go down into this area where this implant's been placed. They love to attach to that implant space and cause an infection and start periimplantitis. And what we do is we take these membranes, the platelet-rich fibrin membranes, and we'll put them on the upper portion around the implant. So basically you have all these white blood cells, you wrap them around the edge so that the bacteria that want to get in there, they can't get in there anymore. Okay, it's a little barrier. And that barrier has a lot of these white blood cells that fight infection. So that's an area where you can use it. Another area, perfect example is, patient comes in, doesn't want implants, but they have 5-6 millimeters of loss of attachment around these teeth. Okay, well, they have these pockets now. And what we can do is we can literally take platelet-rich fibrin and basically tuck it into these pockets, put in a lot more of these white blood cells and regenerative platelets to go into these pockets, fight the infections, okay, and help regenerate the tissues, and you'll get a little bit more clinical attachment in those cases. So, a lot of places you can use it. I literally spend a whole day teaching people how to use it in dentistry, right? So I could speak for hours on this topic.
Yeah, and I think people, this is why I'm trying to isolate some of these things, because this is something that they're doing every day. And this is nothing short of a quantum leap in my mind in terms of to put a protective white blood cell sleeve around the implant as it goes in. It gives you a much better result, in terms of the efficacy and longevity of that, and lowering the risk radically of infection. I think that's really powerful. And of course, with extractions, something like a dry socket would be something you would treat as well, wouldn't it be?
Yeah. In fact, to that effect, there's a lot of people that use it after third molar extraction. So again, when you remove these third molars, imagine you're prone to having a dry socket. And what is a dry socket? Is literally the clot that's formed, right? You're taking a clot that was formed in this third molar site, it's fallen out. Now you have a dry socket. Well, imagine you have a technology to make what we call super clot, right? So if you look up platelet-rich fibrin online, for those that don't know what it is, you'll see this yellow fibrin clot, and we call it like a super clot with entrapment of platelets, white blood cells, etc. You can take that membrane and put it inside this site before you have a dry socket, and put a little cross suture over that heals beautifully. Okay. The percentage of dry sockets goes down dramatically. And some studies it shows goes down tenfold. So as much as 10 times higher. So it's a great technology for that. And if you do have a patient that does get a dry socket, of course, it's very painful. They're not so happy. It's not good for your practice. It's not like it's going to boost business in your practice. But if you do the other thing and you add the platelet-rich fibrin, you're doing a great service for your patient. They're going to heal a lot better. There's lower pain scores, less amount of analgesics that they take. Those have all been shown in studies as well. And you can charge for it. So, you're getting this stuff for $10, and we typically charge in my office $280 to do this. And I'm very, very happy to do so because, like I said, I'm providing a great service for my patients. And a lot of times we just bill insurances for that, and that's covered. So, yeah.
Let me ask about the actual technology and the process of getting the blood. You draw their blood, or a lab draws their blood. You need a phlebotomist to do that, and then it goes into the centrifuge. And how long does that last, or is that you kind of have to use that immediately, or is that something you can store for a while for the patient, like 2 or 3 weeks or something like that?
Yeah, so those are all very good questions, and there's long answers for all of them. So I'll wrap it up very quickly. So number one, every dentist in America can do phlebotomy, right? So it's part of your license. In some states, the worst one's probably California. You may need to do a separate course, which is a couple of days or whatever it may be, and you get a license for phlebotomy. But your assistants can also do it. right? So you can get your assistant to have a phlebotomy license. And in other states, as long as the doctor's in the actual office, then they can do it. So what we've done, for example, in Florida, which is one of the more lenient states, in every office, you'll find some girl, guy that's just going to love doing this, right? There's always, we call it like a little blood queen, where she's thrilled to do it. So instead of doing assisting and suction, et cetera, that person became our phlebotomist in our office. They run around, and every time we have to do these blood draws, she's there, she does the blood draws. Okay. So that's number one. Once the blood draw is done, you want to put it in the centrifuge rather quickly, because in this technology, we're not using anticoagulants. So it's got to get in the machine in typically, a minute to 90 seconds. So that's one thing. Once it's spinning, okay, the spinning process is going to separate these cells based on their density. So all the plasma is going to go to the top. Okay. And that's going to eventually clot. And then when it clots, we can pull those out. Okay. So your next question, how long does that clot last? The answer, the cells at room temperatures will stay, basically alive. They'll survive for up to 4 hours. So you can't do it for weeks. It doesn't work that way. When these cells get extracted from the body, okay, and then you're going to put them down at room temperature, you got about 3-4 hours to use it. So these blood draws have to be done the day of the procedures, okay, and then you're going to use it shortly thereafter.
Yeah, so it's actually something that can be added to a practice. Now, I know doctors like to geek out on technology and stuff that works better than other stuff. And one of the things I heard you talk about is there's a certain way and type of using a centrifuge that gets way better results, gets way more fibrin in the process, right? You're helping to advance the technology with your research as well. Talk a little bit about the centrifuge.
So yeah, it's a lot of, research that goes into this. So for those that don't know who I am or what I do, the first thing that I would say is I'm a practicing dentist that works 2 days per week. Okay. So I do 2 days of clinical activity, mainly in the implant field. So all my research and my time in Switzerland when I was there for 7 years was all in perio. And what we focus on, because I have a PhD in molecular and cell biology, is we develop a lot of biomaterials. Okay. So when I was in Bern, Switzerland, we would work with, some of the top dentists of the world that were located there. And we get, a new bone graft, and we would be the first people in the world to test these new bone grafts, because before a bone graft gets FDA approval, it's got to be shown in studies that it works in cell models and animal models. And then we do the first human testing. And when we collected all this data, then we can go out and get it FDA cleared. Okay. I typically see a lot of these biomaterials or implants probably about 4 or 5 years before they get FDA cleared. Okay. And a lot of them, we have to sign these non-disclosure agreements and other things related to the technology. So that's what I do, right? So most of my time is spent developing these biomaterials, testing them and making sure they're safe, et cetera. And we do that at the university level. So centrifuges, we've been doing PRP, PRF for, about a decade now. And a lot of the technology, what they do is they spin on what's called a fixed angle centrifuge. So I go to a lot of offices today, and they have these, I call them cheaper devices. They're fixed angle, which means that when you put the tube into this machine, it's going in up and down on a 45-degree angle. Okay. And then it's spinning fast. It's like a toupee. It's on an angle, it's spinning, and the cells will separate based on their density. The problem with the fixed angle, guys, is that, if you're on a fixed angle like this, if you're the little platelet that started down here, you're the light cell, and the light cell's got to climb all the way up to the top, because you're
at a 45-degree angle, right?
45-degree angle. So he's coming up this way here. That's not so effective to climb up that way. And these newer centrifuges, what they do, and we were the group that really showed the effectiveness of these devices, is they're called swing out buckets. So the way that it works is it's a horizontal centrifuge. The tubes, you put them in up and down, and they're on little swing out buckets. So when this thing's spinning faster and faster, the tube goes, and then it goes completely horizontally. And then when it's spinning at the top speed, the tube is like this. So that same cell that starts down here, he just has to walk across to the top, which is very easy, okay, as opposed to being on a 45-degree angle. And the cool thing about the field is, like with TVs and other things, horizontal centrifuges used to be 3-4 times more expensive than fixed angle, because it takes a lot more power for that rotor to, swing out. You know, you got to really, as opposed to just spinning a toupee, you got to all the way out. So the advantage of this technology now is that it swings out. Okay. You get better separation of cells. And that was a technology that we developed in Bern, Switzerland, specific to platelet rich fibrin. And the company that launched that was BioPRF. So it was just called BIO-PRF. And, you know, that was the first company in the world. And that was all research that we had done in the lab. So it's kind of cool, you know, we do this work and you know, a few years later, there's a commercial entity that exists that's, you know, widespread around the world, all based on basic research. Now that technology today has been shown by other groups as well to be about 4 times more effective than fixed angle centrifuges. So when these people have, and I go to offices and we do a lot of training, you know, people that have these fixed angle devices, I, you know, highly recommend that if you're doing this PRF, you know, 2-3 times a week or more, you know, you should probably upgrade because you're going to do a lot better for your patients. So.
Well, and you just, if you have 4 times the quantity of PRF from the same amount of blood, that's radically different.
It is, yeah. And very simply, I always, my philosophy and pretty much everything I do is always do what's best for your patients, right? And that's what I live and die by. It's how I've been trained. And you know, when you have a technology that is going to allow somebody to heal faster, you know, and I always say, if you're going to take those vials of blood from your patient, it is entirely your responsibility as a clinician to do what's best for your patient. Okay. And so that's the reason why a lot of people want to learn about it. And after these courses, they really master the technology and then go on and utilize it for patients with great success. So.
I think somebody stole the idea from the county fair for that centrifuge, because I think I've been on that ride, which means my head was full of platelet-rich fibrin by the end of the ride.
You probably got a lot smarter from it. So,
so let's move into other areas, because practices are also starting to work into facial aesthetics. If you want to talk about lasers as well and how that combines with this, that would be interesting to me. That I don't really understand at all. So, and I don't even know if that's actually what happens.
Yeah. So you know, this is kind of a year after year progress, and I'll give you a short breakdown of what's happened. So I'm becoming, with our research, you know, this PRF guy, right? So we're teaching courses, we're doing these different things, we're doing it at the university, et cetera. And every time I'm doing one of these courses, people are asking me, do you use this technology for facial aesthetics? I'm like, no, of course not. I'm a hardcore dentist, biomaterial experts, you know, on and on and on. And next course comes, you know, 4 or 5 people come up. Oh, you got to teach facial aesthetics courses on. And I remember I was sitting down with Quintessence one day, and that's a book publishing company that's published some of our work. And they told me, they said, Dr. Myron, you do know that the facial aesthetic market is about 5 times bigger than the dental market. And I remember thinking about that. And I was like, really? So is that much bigger? So yeah, most of those people are paying, you know, $1,000 for these procedures. You know, if you get even something as simple as Botox, well, if you're a Botox user, it's not a lot like dentistry, where if I place an implant, you know, that's the implant and that's the implant for ideally that patient's life. These fillers and these Botox, people are coming back every 6 months and they get their little Botox shots and repeat business. And a lot of people are doing that. And so when you add that all up, that field's 4 or 5 times bigger than it is dentistry. And I remember looking at that and I'm like, wow, I would have never expected that, right? And then they said to me, you do also realize that you're the PRF guy and they're using this technology all the time in facial aesthetics. I said, yeah, I guess so. And then they're like, well, you should probably teach these courses. And I said, well, I don't do anything in the facial field. So what I'm going to do is I'm going to call up somebody who had taken my course, actually. And her name was Dr. Catherine Davies, and she's a plastic surgeon abroad. And she wanted to learn about the new technology because she was transitioning from PRP to PRF and from a fixed angle to a horizontal. So, you know, she's got a booming practice and very well known in her space. And so, you know, she took the course several years ago, and I said, you know, Dr. Kathy, would you be interested to teach a course with me in facial aesthetics, where I would do the biology of the healing and you will do how to do the injections, how to do the protocols and everything else related to that. And so we launched that course. I think it was probably in 2016 when we first started. Well, it was sold out immediately, right? And to this day, it's my most sold out program, right? Because dentists that enter into that space, they realize that, hey, I can double, maybe triple my practice income if all I'm doing is, I'm working in this one field, which is dentistry, which is about 25 billion per year, the whole market. And I can enter into this other field, which is, 5 times bigger. And if I just take a small percentage of that, and that field is dominated practically by nurses and med spas, it's not by plastic surgeons. Plastic surgeons, they do the big stuff, right? They do the face lifts, the boob job, the nose jobs, the butt lifts. They do all kinds of things that are even more profitable. But just the field of facial aesthetics is a much bigger market than dentistry. And so a lot of, our colleagues are realizing that. And it's actually a fun field to work in. Imagine you come into my office, I say, okay, we're going to extract your tooth, right? Or we're going to extract a few teeth. You're not leaving pleased about this, right? You're like, oh God, that was awful. It took twice as long as I thought. And for that reason, dentists have gotten this kind of patients don't really like dentists, or you know what I mean by stereotypes there. When you work in the facial field and you make somebody look 5-10 years younger, all of a sudden, these ladies are now your best friends. They're bringing you cookies to the office. They're bringing me chocolates. It's just a completely different thing. I have one lady that owns a running store, and she brings me in like all these awesome shoes and stuff, just extra, just like little bonuses. And that would never happen in dentistry, very rarely.
No, there's not a lot of bring the gift to the dentist going on.
Right.
But this is the big shift, because dentists are realizing that they're already working with everything above the neck. And as a marketing person, I immediately think you already have the clients. The hardest part is acquiring new clients. You have a practice full of them already that you can start to introduce this to. And I know you're talking about the women like this. There's a heck of a lot of guys that aren't interested in looking any older. I tend to be one of those guys. I actually let some people work on me during the course. So it's a tremendous opportunity to do something that in some way, and some of this is, I know many dentists who do Botox and have been doing Botox for years. And what they find is that patient is phenomenally good at the recall. They are right on. They're there every 3 months getting their teeth, telling their husband maybe that they're getting their teeth cleaned on a regular basis, but they're getting the Botox at the same time. And so that's it. It brings your patient in for the dentistry that they should be getting, but also giving them this other benefit that is a profitable thing to add to your practice, a benefit to the patient. If they care about their facial aesthetics and anti-aging, this is, again, using their own body materials, right, to improve themselves. This is not using a foreign material or a chemical.
Mm-hmm. Yeah. And to add to that, so, that's the beginning of the story. So we're starting to see that now. As a dentist, I became a little bit more interested in the field simply based on the demand. And there was a few things that I looked at. And number one, me and one of the other educators, Dr. Panapor, did 2-year facial aesthetic masters, clinical masters, of course, after dentistry. So that's one of the other 7 degrees that I spent 2 years studying, where all day long we did Botox, fillers and these things. And quite honestly, when you see people that have gotten fillers, because when you go to the school and you start to see these cases where people are getting these synthetic fillers for many, many years, if this is somebody's lip, you blow it up with the filler because they want bigger lips, and then it shrinks. And then you blow it up again a year later, and then it shrinks. And you do that about 20 times. And afterwards, when you see these cases that have years later, it looks like a balloon that's been inflated and deflated about 20 times. And that balloon starts to get stretch marks and looking old and wrinkly. And I actually think that's not the way to go for somebody that's, I hate it when I see these 25-year-old girls, very pretty, and they want bigger lips. And I think to myself, geez, this is probably not, number one, the healthiest thing to do for your body. But number two, I don't know what you're going to look like later on.
And later on for them is their 40s, right? It's not their 80s.
Right.
They've actually done something that, and it's hard to get people to look long-term at that stuff. But again, it makes perfect sense. You can't inflate and deflate skin over and over again. I mean, women understand that when they have kids, when their breasts swell up with milk, then they shrink, they see what happens to the tissue. They're doing the same thing essentially with this material, and also it's a foreign material.
You're right. So, realizing that, we realize as well, more and more people are, and the field's really advanced. When you speak about regenerative medicine, right? Everybody has heard on the news about, stem cells or all these different things. And that's kind of the big push for the future, is to not just, try and put a filler necessarily, or try and put a polymer or some other source of material, really to try and regenerate tissues and keep them younger. And that's kind of where the field was going. So between that and then the second half of that puzzle is really using lasers. So we use a lot of the Photona Lightwalker technology that we teach in the course, and people get a feel for what can lasers do. And that's an amazing technology as well. But from my point of view, it's a natural one, right? So I'm shining a light on a tissue in a specific wavelength, and it's going to activate fibroblasts to make more collagen. And it's all done at specific frequencies and protocols, et cetera. And we've had a lot of impact by, stimulating those growth factors, or stimulating the cells, right, to make more collagen with the light. So away you go. And then we put in a little bit of the growth factors, the super dose of growth factors. And one of the instructors calls it like putting a gasoline on a fire, right? Because now we're throwing in the growth factors that'll help stimulate these tissues. And the results have been just awesome. So, in my city where I work, we've seen more and more people talk about it. So I've treated, one person who tells their friends, and then they come in, and then all of a sudden it's become big. And after I've done that, now I've gone to courses and I say, hey, you're a dentist, you're getting burnt out, or you're tired of doing just dentistry. I see a lot of people that are in their 50s, 60s, and they just say, I'm kind of tired of just doing dentistry. I say, well, I got something for you that you're going to have a lot of fun doing. And it's very profitable. Okay. For me, myself, it's more profitable than doing dentistry. And that's the cool thing about it, is that I don't have as much stress as a normal dentist does, definitely. And like I said, I've been there doing all the complex cases, et cetera. And so it's been a real fun journey, and it's actually my favorite course to teach is these ones here, because like I said, I see my colleagues and they go out and they're making a lot more money now. And what does it cost you, right? When I do these procedures, we typically charge $1,400 to do the full package. So let's say somebody comes in and just says, I want the complete works. That's a $1,400 procedure that lasts about an hour and a half, where we go intraorally, we do some smooth lays and some laser peels with some microneedling with PRF, so the vampire facials. We do some injections. So it's, obviously it's a 3-day course that we teach. But when they leave with that, I look down and we've spent almost no money at all. I just powered up my laser that's already bought, right? I'm spinning my centrifuge with about 4 tubes, which costs 82 cents each. And I needed a butterfly needle. Okay. So the stuff's costing me $30, $40 in totality, and I'm doing a $1,400 procedure. If I was doing implant dentistry, even if I charge $3,000 for an implant case, I got to pay for the implant, the abutment, the crown's coming later, the bone graft, potentially maybe 1 or 2, a barrier membrane, there's all these added fees there. So this field's a lot of fun to work in.
Yeah, I can see where a doctor would want to add it, and it's not, for everything you're saying, I don't think is as physically demanding as oral surgery or an implant case of some kind, or even crown and bridge dentistry.
Right.
So
yeah, I have a very important comment to make to that too. More and more dentists try and do a little bit of everything, so I specialized really in the field of perio. So, my training is much more extensive than most people, just because I lived in an academic environment, and I was with some of the best people in the world there for 7 years in Bern, very affiliated with these implant companies. So all the major implant companies of the world are from Switzerland. Nobel Biocare's in Switzerland, Straumann's in Switzerland. We collaborate a lot with them. And of course, our training, I think, is a little bit, advanced there in those places. Well, when you are a general practicing dentist, when you place implants as a GP dentist, always remember that you're held to the same standard as a specialist, right? So if you place an implant and things go south and you're sitting in front of your board, they look at you and they say, okay, Dr. Smith, this is the case that you've done. And if you've made poor decisions on your decision-making, which is you're competing now against specialists that for 3 years of training, that's all they've done, right? If things go bad, that looks pretty awful. So as a dentist, you want to place implants, you're going into a $5 billion market, let's say. So there's a lot of potential to do stuff, but you're competing against these specialists that have done 3 years of training on this side in implant dentistry. In facial aesthetics, imagine, who is my competition now in the facial aesthetic field? Well, I think I was reading an article and it was 80% of these minimally invasive facial aesthetic procedures are done by who? Not by plastic surgeons. They're done by nurses. So on this side, I got to compete against oral surgeons and perios, and that's a $5 billion field. And if things go bad, I'm sitting in front of a board and I got an oral surgeon or perio there. On this side, I'm competing against nurses. Okay. And nothing against nurses. Of course, there's a lot of great nurse injectors and everything else. But the reality is that when both these people enter in these fields, a nurse has her 4-year degree, right? A dentist has his 4 + 4-year degree. Okay. They learn a lot more about facial anatomy. Okay. They learn a lot more about, chemical products, about biomaterials, about integration of the body. They have a lot more training essentially. Okay. When it comes to injecting, let's say I'm going to inject your face, this nurse has to start from, almost never done an injection to now get better and better and better at these injections. When you look at a dentist, imagine my training as a dentist is go inside these complex areas that are very dark, find lights, bend your neck down, go all these different places and do these injections, which if you think of all the injections in the world, probably the hardest place to do some of these injections is in the oral cavity, right? Then all of a sudden you're working in a field, they say, okay, we're going to augment your cheekbone because your tissues are starting to fall down. And your job is to go with a needle, bing, in a straight line, visible light, shining everywhere, go in, inject it, and then you get a nice lift of these tissues. Okay. Well, as a dentist, that could not be any easier. So when we have these people in the courses and these dentists, they're just phenomenal injectors. So to migrate from doing the injections in the oral cavity to outside the face, life becomes easier. And like you said, you're not having to bend backwards and ruin your back and on and on and on. So pretty cool place to work, definitely.
Well, and dentistry is a physically demanding career. You are a surgeon and in a mechanical challenged position. Many, like ergonomically not ideal. A heart surgeon is in a better position than you most of the time in the way he or she gets to work. And if you can do general dentistry for 2 days a week and aesthetics 2 days a week, you're gonna last a lot longer, make more money, and have happier patients, attract more patients. And again, I always look at the marketing side of it is, why not have a booming practice with happy people that talk about you? Who cares why they're talking about you? If they say, he's a great dentist, he's fantastic, and by the way, he does a little facial aesthetics, and that's why I don't have any wrinkles, all of a sudden the phone is ringing. And that's how to build a practice, is by creating a remarkable experience. In that word that I always use, literally, they're remarking about you in a positive way. This is a way to get an overload of positive word of mouth out there for you. So it's very exciting. I just want people to know that in the show notes, I'm going to put Rick's lab, the Miron lab website in there, and also a link to how you sign up for courses, because he travels all around the country and does all of these courses. And I think you're going to want to add this, because some of this technology, again, you're treating your patients from a medical side, from a dentistry side, and then also from a cosmetic side. with the same technology, the centrifuge, the lasers, all of that stuff serves both sides of the practice. That's kind of wonderful. And it's, a laser's expensive, but only if you don't use it, technically.
Yeah. And I have a couple of comments to make related to that as well. So, it's not to say that it's for the field, a dentist doing these different things for everybody. But, there's a large percentage of people that just grow tired of either doing dentistry or want to add it and do different things. And I want to tell you a few stories related to it, because we've been doing it for 4 or 5 years, right? So we've seen a lot of people that we've trained go out and be very profitable with all these different things and et cetera. So the best example I can give you is, number one, when we started doing this in my city in Sarasota in our office. I don't own the office, okay? I just go in and I work for somebody else, Dr. Michael Canner. And when I was doing these cases, he said, look at the med spa across the street, right? Look at the med spa across the street. They said, that's a nurse that opened that up, right? And she's going to have now a business related to doing these facial aesthetic procedures. And a lot of them become very, very successful. But if you actually think about this logically, okay, when they want to attract a new patient, she needs to spend thousands of dollars on ads, whether it be on social media, putting ads in the journal, newspapers, et cetera, whatever it may be, right? In that office, there's already thousands of patients walking through. So if I just put up a bunch of banners in our office, right, and I start saying we do this, and everybody that's coming in for their routine dental care is saying we offer the same treatment that they're doing across the street, but instead of having a nurse do it, it's going to be a doctor, a dentist, right? You have a huge advantage when you think about it from a marketing standpoint. And that's obviously your field more than it is mine, but that's just logical for anybody in that space. Then imagine if I'm a nurse and I just opened up across the street. One thing that we've seen, because we've been doing this for a long time now, is they have to slowly, gradually get these new technologies. We have these phenomenal lasers that we can use in that field, but also in dentistry. So I can afford to use and buy this higher quality equipment because I'm using it in many different aspects, whereas they're having a hard time, right? So, and we don't have to spend as much on marketing, so it's more profitable, and on and on and on. So there's a ton of advantages that way there. That's why I tell people is, the next point that I wanted to make is, even if you don't want to do these procedures, even if you're like, I'm a dentist and I love what I do, because there are people that are like that, right? Sure. And there's nothing wrong with that. I know dentists that just hired a nurse and they say, you know what, you're not going to go open up your med spa across the street. What's going to happen is I'm going to hire a nurse. And when all these patients are running through my office all the time, we just say, oh yeah, we do these procedures. This is the person that does it. And they hire nurses to work in their offices to add on to these procedures. And, you can work out an arrangement with that nurse. But even if you split, let's say the profits 50-50, you're bringing in all this extra income that you would have otherwise not had. And those patients would have been going somewhere else to do these procedures, right? So since every person in the United States has a dentist, so every person's running through there and constantly going. And if you just put up some marketing material saying we do these things, whether or not you do them or you hire a nurse to do them, it's a huge field. And I really recommend that more and more dentists get involved in it, because like I said, you can really make a lot of extra money.
Well, and the word of mouth you have in dental practices, mostly women working there. It's a lot easier for one woman to say to another, we could really do something for those crow's feet. We've added this technology, rather than a male dentist suggesting that. There's this opportunity to use the female bonding as more internal marketing. This is so self-propelled from a marketing standpoint. There's so little expense associated with it that it's a phenomenal opportunity. And of course, it builds a dental practice, because those people have teeth too, and they're getting older, and they're not necessarily aware of the value of maintaining their teeth. But then eventually you can say, look, you're missing a couple of teeth here. That's not healthy at all. We do implants. And so one side just keeps feeding the other, and it's all positive in my mind. If you're making somebody look better and healthier, however you're doing it in a dental practice, that's a good thing. If you're building confidence, that's a good thing to send somebody out on the street with, as well as making them healthier at the same time and not using foreign materials. The more you use materials like the stuff that you've been developing for your career, the better it is for that person. They're not putting something toxic that there's a long-term negative effect of it. So it excites me, even though I don't understand necessarily how it's done. I like the positive impact it has on the patient base and on the industry, because again, anything that elevates dentistry in people's minds is really valuable too. So.
Yeah. And I have another story to share with respect to that too. So when we started, and this is, you'll be a little bit more expertise in respect to this, but we started advertising. I work at Lakewood Ranch Dental. And so when we were Lakewood Ranch Dental advertising facial aesthetic procedures, right? So let's say through our social media and Facebook, it kind of had a ring to it that may not have been as exciting, right? So it's like Lakewood Ranch Dental doing these all natural facial aesthetic procedures, right? And what we realized was we just said, you know what, with Dr. Cantor, let's rebrand it. And so what we did, and I've seen a few people do this now, is we rebranded completely to what we call today Care Aesthetics. And that stands for the Center of Advanced Rejuvenation and Aesthetics. And the CARE stands for care. So we have these nice logos that say, Care Aesthetics, we care about you, whatever it may be. And it has a nice ring to it. So we run the exact same ads now with Care Aesthetics, which Care Aesthetics is located in Lakewood Ranch Dental, obviously, right? It's just like a little side branch that we have to our office. All of a sudden things started booming, right? We had these free consultations. People would come in and we ran these ads. And if you go to the Care Aesthetics website, it's just care-aesthetics.com. The first thing that comes up is all natural, no chemicals, regenerative strategies to facial aesthetics. And we really focus on that, all natural, no chemicals, no additives, right? And you cannot believe the amount of people that come in and said, I got Botox and I hated it. I mean, one eyebrow was working, the other one wasn't. I had fillers and had a reaction. I would say probably 30% of the people that come in, for complications related to one or the other. So that's pretty cool. And the risks associated with doing these different procedures, there's no risk of putting somebody's concentrated platelets back into their body, right? There's no real risk of shining a laser on somebody's face to stimulate collagen. So the procedures go down in the amount of risk that's going, and people like it, like I said. So it's been great. So then I had a buddy of mine, and he's an educator with me in the Prp courses. And he says, wow, it's so cool what you've done with this Care Aesthetic stuff in Florida. I said, and then he says, can I do the same thing in Cleveland? I said, what do you mean? He's like, I just want to use all your marketing material. You've spent, whatever, $100,000 or more building this whole thing up. Can I just buy the exact same banners from you and the trifolders and everything you've done? And I'm just going to set up, I'm going to be the Care Aesthetics in Cleveland. I said, sure. Well, I don't see why not. You're not going to compete with me, obviously, down in Florida. So he did that. And that was a couple of years ago, and then became very, very successful with it. So basically what my office did was we gave him the playbook, right? Yeah. The green button that just said, here, away you go. And so now what we've done is with this Care Aesthetic thing is we teach a series of 3 courses. And when you complete all 3, you get the green button and you become a Care Aesthetic provider in your region, which means that you don't have to worry about a lot of these different things, and away you go. And it's been, very successful for a lot of these guys that are really interested into it. So it's been cool. And to your point too, with respect to your offices being primarily females, and you can relate a lot better. We've seen this even in dental schools. More and more females are joining the dental profession, obviously, as dentists. And so I think a lot of these females just know a lot about the field, right? A lot of people that come into the courses, I'm amazed. I mean, they know all about facial skin care, product lines, what retinols do versus that versus this. They've had Botox and fillers injections, so they've learned about all these things. And they have the best hands in the world, these dentists, because that's what they do. And so to transition from what you know already and just, start doing these procedures, it's a very smooth transition for a lot of these females. I would say probably easier for a female dentist to do that than a male. Okay. Because a man doesn't really know a whole lot about it. They just have great hands and an interest in doing it. So.
Yeah, they're good with the injections and things like that, and general dexterity, but the females are going to know way more about it. One more thing I wanted to talk about, because I know that you're using this when you're doing laser treatments. You've started to use the Clara mask, the Clara air filtration system, which is a replacement for N95s, and it has multiple advantages, and you like it in particular when you're doing laser procedures. So I wanted to hear your thoughts on that.
Yeah. So I'm always amazed at the medical side. Okay. And I'll explain to you why this is, because I think what they do is kind of a little bit, maybe health hazard. I would almost say it that way there, because when you do these procedures and you're using a laser in particular, a lot of the procedures are ablative. So we take a laser and, if you have a mole, I'll take a laser and we can just laser it off very calmly, layer by layer. But what it's doing is you're creating all these plumes, and these plumes are right in the air. So as dentists, what we do is, of course, we would wear a mask like everybody else would, because, you don't want to be breathing in this person's skin plumes that is exploding. So we have our suction device, and with our suction, while we're ablating the plumes, we're sucking it up with a normal high-speed dental suction. Okay. In medicine, they don't have that in their offices. It's not normal for these offices to have compressors, et cetera, et cetera. So they do these procedures. And I went to a medical course for aesthetics and lasers a couple of weeks ago, and you walk into these rooms and they look like little smoke bombs of skin that's been, off these people's faces. Because when you do laser peel, that exists. When I saw the Clara and, the ability of the mask to be attached to the HEPA filters, I said, oh my God, this is beautiful for lasers. And because when we're doing all this now, I don't have to worry about, necessarily, an N95 mask is great and everything else. There's nothing I'm going to say that's wrong about these things conceptually, but it becomes kind of a pain to be wearing these things and trying to breathe in and out through the mask all day long, et cetera, and not as effective as using it with the HEPA filter. So the advantage of having that, and not for sure, never breathing in these plumes that I'm creating, when I'm working in the space all day long, it's just been a real blessing. Like I said, we have it for myself and our assistants, just to make sure that, like I said, everybody's not going to endanger themselves, right, with all the plumes that they breathe in. So I think, and I told people in all of our courses, if you're using a laser, the way that we intend you to use it, where they're powered up all day long because you're doing one procedure after the other, make sure you're breathing in good quality air during those procedures. So that's where that mask has been really useful for us.
Yeah, and it's designed to be comfortable and worn all day, and to constantly breathe fresh air, but it is all HEPA filtered air, and you're not getting and even because of where the filter is, you're not getting the smell as much through, because there's a certain amount of that you pick up as well when you're doing skin. In the medical side, if they're not using suction, like dentists have, as you say, they have the technology. But even with that, the smell still appears even with suction. So if you can protect yourself from that too, it's another advantage. So anything else you want to add? Because I know you talk about this stuff for days, and this is really whetting people's appetite for all that can be. And I'm going to make sure that they can find you and squeeze their way into one of your courses one of these days. But I think what this really shows me is that dentistry is really coming into another golden age that's going to be based on biogenetics and things like that, and biomaterials. These things are going to transform how we deliver dentistry. And now my mind is expanded to like all of these treatments beyond the teeth and the gums to the whole face. So, and if you're doing a med spa, technically the whole body, within the practice. So.
Yeah. And I think just in general, if you think about it, and I tell this to younger dentists too, I say, look, many years ago, if you're a 55, 60-year-old dentist, it was fantastic for you to work into things like implant dentistry and these types of fields, crown and bridges and all these things. But I say, if you look at dentists that graduate today and they want to treat these patient populations for the rest of your lives, look at patients that are 30 years old today and younger. How many of them are missing teeth, right? Not very many.
No.
40 years ago, a lot of them, right? But today, I expect actually a big percentage of 30-year-olds today and less, and this whole generation of millennials that are going more organic and want these more natural things, which is great. I mean, by all means, that's the way to go. They're not going to be replacing their teeth with implants and other things later on. They're going to look more for regenerative strategies. When they do start to get a little bit of periodontal loss around their teeth, how are you going to regenerate that, right? And that's why I think that field is so beautiful to work. They're going to work hand in hand. And then a lot more of these people, as we've seen from 50, 60 years ago to today, and look at the difference in aesthetics, my gosh, especially in the United States, the desire of people to want to look younger has probably never been greater, right? And so if you enter into that space, of course, you're really doing a service for your patient, quote unquote. And I look at it, when I look at what I do, I just think, I've been able to do all of these different procedures that are a lot healthier for women to make them look younger. And I'm actually proud of it, right? I just say, I try and promote the fact that, hey, don't put those chemicals in your body. Don't do this, don't do that. Let me show you what we can do, with science, right? And so that's a cool place to be. And it's been very successful in my city and in our practice. And I'm sure all around United States, there's a huge opportunity for everybody. So I hope, like I said, people will consider it. For those that are interested, like I said, you can find us in our PRF EDUs where we teach these courses, and we'll provide the link for that. So.
Yeah, it's very exciting. I plan to live to be 150 years old or more, and I'd like to look better than I do now for most of that. So I'm counting on you, Rick, to keep coming up with stuff and then trying it on me, basically, and making sure. But yeah, I do believe you are doing a good thing, because people are going to do cosmetic stuff anyway. They have done it for centuries, and a lot of it is dangerous or toxic or some combination of the two, or has long-term negative effects. The more we can move people into something that is natural and healthy and bio-derived rather than synthetic, I think is really important, because it will be done. So let's help them to do what's safe and longer lasting, and it probably better results too. So.
Yep. Fully agree.
So thanks so much for your time, Rick. I'm sure everybody will want to know way more, and they'll be coming at me and you. So that's great. As always, everyone listening, the show notes will tell you a lot of the links that Rick and I have been talking about, so you can find those. And if you like the podcast, tell your friends, subscribe, do all of those things. Even if you don't like it, subscribe anyway. It makes me feel good. So, in meantime, everyone, keep being remarkable. Thank you, Rick.
Yep. Thank you. Have a good one.